As we all know, the CDC has been using models to predict the spread of coronavirus. Now, health technology company Kinsa Inc. says the data gathered from users of smart thermometers can help predict the future of COVID-19 outbreaks. Here to explain is Kinsa CEO Inder Singh. Inder, thanks so much for joining. Just real quick, can you explain how your thermometers work and what they can tell health authorities?
So we've turned the most common medical device into a communication system. So Kinsa thermometers don't just tell you a temperature, they guide you on next steps. Whether to go to the doctor or treat this at home. And we now have more than 1 million households using these products across America, so we're able to map fevers across the country. On March 18th, we launched healthweather.us, which shows where fever levels are high or low, above and beyond what you would normally expect for cold and flu season. And as far as we and others can tell, that's the first and best sign of COVID-19 spread in the community.
So as of today, what's the temperature picture telling you? Where is it growing and where is it getting better?
So I'm excited to say that we're seeing that every location where there's been aggressive social distancing, stay at home, shelter in place, we're seeing fevers get close to zero. That's really an encouraging sign. That doesn't mean that COVID cases won't increase, but it does mean that the number of newly infected people is dropping dramatically. The one location where we're not seeing it go towards zero is New York City. And that's a concern. New York is a high-density city, and it's probably very hard to do aggressive social distancing for extended periods of time there. So I am concerned about New York, and I think everyone right now is pretty concerned about New York.
Sure. There's been a lot of talk about measuring temperatures at ports of entry, maybe even to get into a football stadium. But you're actually focused on the family. Why is that?
Yeah, so we want to be able to talk to people while they're still in their home, before they ever go to a port, before they ever go to a baseball stadium. And we found that that provides the earliest of early warning signals. If you see something spreading in the home, well, that's a good indicator that it may start spreading in the local community. And that's why we that's why we work with people in their homes. And the other reason, of course, is that we can help people when they're still in their home get better. And so it's not just an early detection system, an early warning system, it's also an early response system.
Now, should people be worried about privacy issues? They're being tracked somehow?
I'm glad you asked that. The answer is no. We do not share personal data at all. What we share is population health information, the percentage of people in a county that are sick. There is just no way to identify an individual from an illness signal like that.
Gotcha. But interestingly, a parent can look at your app and tell if their fifth grade student maybe is just part of a broader problem in the school, and whether it's a big problem or not a problem at all. Can you explain that?
Yeah, so in about 1,500 schools across the country, mostly Title I schools, underserved communities, we and partners have given away thermometers for free. Lysol is our biggest corporate partner, and again, the thermometers are entirely free for the community. And you, as a parent, and the nurse and teachers can now see whether the illness level is high or low in the school and where it's spreading. And nurses can message out to the community. They can message out to an individual grade and the parents in that grade saying, hey, here's what's going around and here are the actions that you should take. One of the reasons why we've done this program is because schools are one of the places where illness spreads rapidly. And school children bring it home to their parents, who then take it to work or spread it to the grandparents. And the first question you always ask, if you're a parent, the first question you always ask is what's going around, right? Because everything starts the same way. And the question is it flu? Is it strep throat? Is it something else? Is it COVID-19? And so that program really helps us to understand what's going on, and it also helps us to help the community respond. I'm really excited and encouraged by the program. It's shown that we can curb flu spread over the last several years, and we believe it's going to be even more important in this coming flu season with COVID-19.
So real quick, can you tell us two states that I believe you are announcing partnerships with, but then more importantly, how should health authorities be using this sort of technology in the future to nail COVID-19 and then prevent future pandemics?
Yeah, so I'm excited that we're starting to work with states. I can't announce who they are yet. I don't have permission, but we're starting to work with state and local government to deploy more smart thermometers into the community. In terms of how this should be used, think of this as an early warning system. It's a system that says, it's like a light bulb going off on a map saying something's going on here, send the test kits in, send the virologists in, and it's really, really important in the context of an epidemic to have an early warning system so you can direct the resources to where they need to go. And that's what we've essentially built at healthweather.us.
And ideally, you would like to actually see federal or state authorities ask health providers to aggregate this information, send it to you or someone else so that there's a national database. Is that right?
Yeah, I mean, I see this as just fundamental infrastructure for our country. We're using 21st century technology to understand where and when disease is starting and spreading. How do you stop an epidemic if you don't know where it's starting and spreading? The answer is you can't. And so this is the kind of technology that needs to be out there as that early warning beacon, right? Saying, again, send the test kits in, send the virologists in. And the other thing is that you can also monitor how effective your interventions are. If you see fever levels curving off and dropping to zero, that's a good sign that you're breaking the chain of infection.
Inder Singh, thank you so much. Keep us informed as to how this is all going.